Welcome. My name is Clarice Warner. I'm the Girl with the Pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. Thank you so much for joining our webcast. So I'm really excited to discuss with you some little nuggets that I gleaned from the 2018 ICD-10-CM coding guidelines. I hope you stay till the end, as I will share with you information on a free email course that will help you in your medical coding profession. During this time, together I will define the coding guidelines if you are new to medical coding and don't know exactly what the coding guidelines are. I will also review the narrative changes for the 2018 diagnosis coding. If you haven't already downloaded the guidelines, you will find them at the Centers for Disease and Prevention, or CDC's, website. They are listed or will be printed in your 2018 ICD-10-CM coding manual, so you will have them as a reference. And let me share a little secret. If you are planning on taking a coding exam, these guidelines are part of the approved resources that you can have during your exam. And you see the link to the PDF website there for the 2018 guidelines. So feel free to use that. You can also Google that information as well. So what are the official guidelines for coding and reporting? Well, these guidelines, first of all, are approved by 4 high-level organizations. They are the American Hospital Association, the American Health Information Management Association, the Centers for Medicare and Medicaid Services, and the National Center for Health Statistics. The guidelines are actually a set of rules to accompany and complement the official conventions and instructions in ICD-10-CM, and I affectionately call them I-10, so you'll hear me refer to the diagnosis coding manual as I-10. ICD-10-CM actually is the International Classification of Diseases 10th revision clinical modification. And I-10 is a disease classification published by the United States for classifying diagnoses and the reason for visits in all health settings. Please know that the instructions and conventions of the I-10 manual takes precedence over the guidelines, but the guidelines are based on coding and sequencing instructions in the tabular list and in the alphabetic index in your I-10 manual, and they provide additional instruction. So let's jump right into the changes in the guidelines. In Section 1, Conventions, General Coding Guidelines, and Chapter-Specific Guidelines, there were some changes in Section A, Conventions for I-10, in Section 15, the width, and Section 17, Code Also Notes. So with there was a couple word changes, but then there was some additional guidance. So in Section 15, the word with or in should be interpreted to mean associated with or due to when it appears in a code title, the alphabetic index, or an instructional note in the tabular list. The classification presumes a causal relationship between 2 conditions linked by these terms in the alphabetic index or tabular list. These conditions should be coded as related even in the absence of provider documentation explicitly linking them, unless the documentation clearly states the conditions are unrelated or when another guideline exists that specifically requires a documented linkage between 2 conditions. For example, sepsis guideline for acute organ dysfunction that is not clearly associated with sepsis. For conditions not specifically linked by these relational terms in the classification, or when a guideline requires that a linkage between 2 conditions be explicitly documented, the provider documentation must link the conditions in order to code them as related. And in Section 17, Code Also Note, a Code Also Note instructs that 2 codes may be required to fully describe a condition, but this note does not provide sequencing direction. The sequencing depends on the circumstances of the encounter. In the general coding guidelines, there is new instruction under multiple coding for a single condition. In addition to the etiology manifestation convention that requires 2 codes to fully describe a single condition that affects multiple body systems, there are other single conditions that also require more than 1 code. Use additional code notes are found in the tabular list at codes that are not part of an etiology or manifestation pair, where a secondary code is useful to fully describe a condition. The sequencing rule is the same as the etiology manifestation pair. Use additional code. Indicates that a secondary code should be added if known. And then they go on and give an example, and then the next piece with the new language. Code first notes are also under certain codes that are not specifically manifestation codes, but may be due to an underlying cause. When there is a code first note and an underlying condition is present, the underlying condition should be sequenced first, if known.
Are you interested in medical coding, but not sure where to start, and scared of wasting time and resources? Let me help you with the right steps to become a certified, marketable medical coder. Learn more at bit.ly/5stepscoder.